Welcome to the Omni Dental Podcast. Today, we are diving deep into a topic that honestly affects pretty much everyone's long-term health, but it's still surprisingly confusing for a lot of people. We're talking about the critical distinction between a regular, routine dental cleaning and a deep cleaning.
It's such an important topic, and it's way more than just, different names for the same thing. It's really the difference between preventative maintenance and, well, an actual therapeutic necessity.
Right. I think a lot of people just hear cleaning and assume it's all the same.
Exactly. But understanding the why and the when for each of these procedures is absolutely vital. We're talking about saving your teeth, and sometimes it can even impact your overall health. Our mission today is to just unpack all of this and give you a really clear guide.
And for our context today, we're basing our exploration on the comprehensive approach that's advocated by Omni Dental and Medspa, which is located in Arlington Heights, Illinois. The practice is led by Dr. Bilas Poles, DDS, and it really operates with this patient-first philosophy that's built on more than a decade of experience. They do everything from the routine, preventive stuff we're talking about today, all the way to advanced treatments.
And that breadth of experience gives us a really solid foundation for this discussion. That holistic view is essential. Dental health isn't just about one-off procedures, it's a whole journey.
A journey, that's a good way to put it.
Yeah, and the first big signpost on that journey is knowing the difference between a cleaning designed to prevent a problem and one designed to fix a problem that's already there.
Okay, let's just jump right into that core difference then. So a regular dental cleaning is purely preventative. The goal is to keep trouble away.
Think of it like taking your car for a regular oil change. It's just good maintenance.
Right. But a deep cleaning, that's therapeutic. That's not maintenance anymore. That's like taking the car to the shop because the check engine light has been blinking for months. It's a treatment.
That analogy is perfect, actually. When we're talking about a regular cleaning, we're talking about keeping healthy gums and bone healthy. The second we shift to a deep cleaning, the formal name is scaling and root planing, we're actively fighting against existing gum disease.
And this is why it really matters to you, the listener. If you ignore those early signs and let that tartar build up below the gum line, you're not just risking needing a deep cleaning later on.
No, you're risking much more serious consequences. Untreated gum disease is, it's insidious. It's a chronic infection in your mouth.
Which can't be good.
It's not. It doesn't just damage the gums. It starts to eat away at the bone that holds your teeth in place. And when that bone is gone, teeth get loose, and eventually you can lose them.
Wow.
And beyond that, we now know there are strong links between chronic inflammation in the mouth and systemic issues, like cardiovascular health. So this isn't just about your smile, it's about your well-being.
That definitely raises the stakes. So, okay, let's start with the baseline then. The one most of us know, or should know, the regular dental cleaning. I think the technical term is prophylaxis cleaning.
Yeah, prophylaxis. It literally means to guard against disease. And that's exactly what it is. It's your routine defensive shield.
And who is this for? Is it for everyone?
It's for patients who generally have healthy gums. People who brush and floss regularly and have just a minimal amount of plaque and tartar buildup.
So why is every 6 months the magic number we always hear?
It's all about the life cycle of plaque. For most people, 6 months is about how long it takes for that soft plaque, the stuff you can brush off, to start to mineralize and harden into what we call calculus or tartar.
Ah, and once it's tartar, your toothbrush isn't going to do anything.
Nothing at all. At that point, only a professional cleaning can get it off. So the goal of that 6-month visit is to remove that hardened stuff from your teeth. And this is key, just along the gum line before it can cause inflammation.
And what does that look like in the chair? What are the steps?
It's a pretty straightforward process. The hygienist will use some special tools, maybe an ultrasonic scaler and then some hand instruments, to gently chip away the tartar.
Okay.
Then comes polishing, which smooths out the teeth and makes it harder for new plaque to stick. Then a good, thorough flossing. And finally, the dentist comes in for the exam, which is a super important part of prevention. They check your gums and screen for any early signs of cavities.
And it's pretty quick, right? Usually about 30 minutes. There's no recovery. You just walk out feeling clean.
Exactly. It's comfortable, it's efficient, and sticking to that 6-month schedule is really the best way to make sure you never have to cross that line into the next type of cleaning.
Which brings us to it. Let's talk about crossing that line. What happens when that checkup reveals something more serious? This is where we get into the deep cleaning or scaling and root planing.
Right, and this is where we're not preventing anymore, we're treating. A deep cleaning is needed when that tartar hasn't just been sitting along the gum line, it's actually invaded the space beneath it.
Beneath the gum line.
Yep. Healthy gums form a nice, tight seal around your tooth. But with gum disease, that seal breaks down and you get these deep pockets that become breeding grounds for infection.
So who gets this?
Yeah.
Is it just for people who haven't been to the dentist in like 10 years?
Well, neglect is a big factor for sure. But it's not the only one. Genetics can play a huge role. Some medications, smoking, and even other diseases like diabetes can make you more susceptible, even if you're pretty good with your home care.
So what are the signs then? What should someone listening be looking for at home that might signal, uh-oh, I might need more than a regular cleaning?
The signs are surprisingly common, which is why people often dismiss them. Number one, without a doubt, bleeding gums. When you brush or floss, that is not normal.
I think a lot of people think it is. Oh, I'm just brushing too hard.
Right, but it's a classic sign of inflammation. Also, look for swollen or really bright red gums. Persistent bad breath is another big one. And maybe the most obvious is gum recession, when your gums start pulling away from your teeth, making your teeth look longer.
Okay, if you see any of that, it's time to get it checked.
Absolutely.
So let's get into the mechanics of it. Scaling and root planing. It sounds like two different things. Let's start with scaling. What is that exactly?
Scaling is the, let's call it the heavy lifting part of the cleaning. The professional uses their instruments to go below the gum line and remove all that calculus and bacteria that's stuck to the root of the tooth.
That sounds more intense.
It is, and that's why it often requires local anesthesia. We need to make sure you're comfortable because we're working in a sensitive, infected area.
And you mentioned before we started that a deep cleaning can take 1 to 2 hours per quadrant. Can you explain what a quadrant is?
Oh, yeah, good question. We divide the mouth into 4 sections, or quadrants. So you have your upper right, upper left, lower right, and lower left.
Okay.
And because this is such an intensive procedure, we almost never do the whole mouth at once. We'll do 1 or maybe 2 quadrants in a single visit. It just makes it much more manageable for the patient.
That makes a lot of sense. So after the scaling, after all the scraping is done, we get to the second part, which you call the aha moment, root planing. What is that and why is it so important?
Okay, so root planing is the real therapeutic key. See, when tartar builds up on the root, it doesn't just sit there. It actually makes the root surface rough and pitted. You can think of it, well, like it turns the root surface into Velcro.
Velcro. Okay, I get that. So it just attracts more plaque.
Precisely. It's a magnet for bacteria. So the whole point of planing is to smooth that root surface back out. Get rid of the Velcro.
And what does that accomplish?
Once the root is smooth, the gum tissue has a clean surface it can heal against and reattach to. And that reattachment is the magic. It shrinks those deep pockets, which eliminates the place where all the bad bacteria were living.
Yeah.
It's not just cleaning, it's literally repairing the area to prevent the problem from coming right back.
That is a huge distinction. So you're not just cleaning up the mess, you're fixing the leaky pipe that caused it.
That's a great way to put it.
Now, what about after? You said there's anesthesia involved, so I assume recovery is different from a regular cleaning?
Oh, definitely. You should expect some soreness, maybe some tenderness for a few days, possibly a little bleeding or sensitivity to hot and cold. Your dental team will give you specific aftercare instructions, maybe for some rinses or over-the-counter pain relievers. It's a bit of a recovery process, but it's a necessary part of healing.
So if a regular cleaning is every 6 months, what's the schedule look like after you've had a deep cleaning? Are you just back to normal?
Not usually. Once you've had gum disease severe enough to need a deep cleaning, you're now managing a chronic condition. So instead of a standard 6-month cleaning, you'll likely be on a periodontal maintenance schedule.
And what does that mean?
It's more frequent. It might be a visit every 3 or 4 months to make sure the disease doesn't become active again. It's a highly personalized plan based on how you're healing and maintaining things at home.
It's not one size fits all. It really depends on the person.
Exactly. And that's where a patient-centered practice like Omni Dental really shines. They're not just following a textbook. They're creating a plan based on your specific clinical needs.
So for the listener who's maybe a little worried now, what's the big takeaway?
The main thing is you can't self-diagnose this. The only way to know if you need a regular cleaning or a deep cleaning is to have a professional evaluation. They need to measure those gum pockets and see if the infection has gone below the gum line.
And it's interesting how a practice like Omni Dental and Medspa really leans into that need for precision. They talk about tailored care for everyone in the family.
Right, and that tailored care is really supported by their use of advanced technology. Better imaging, better tools. It all means that when a deep cleaning is needed, it's done with incredible accuracy. That means better results and better healing.
It seems like it's all part of their philosophy of being a partner in your health.
It is, right down to their commitment to being environmentally friendly. It's about caring for the whole patient and the community.
That really is the standard for modern care. So before we wrap up, let's leave our listeners with one final thought to chew on, something that connects all of this.
Okay, so we've talked about how the frequency of these maintenance cleanings after a deep cleaning depends on the severity of the disease, right?
Right.
So here's the question to think about, especially with a practice like Omni Dental that emphasizes advanced diagnostics. How much does that consistent, high-precision technology change the game? Does finding and measuring these problems earlier and more accurately mean we can actually reduce how often those big interventions are needed over a lifetime?
That is a great question. Better tech leading to less invasive care over the long term. Something definitely worth discussing with your dentist. And if you are in the area and want to experience this kind of patient-centered, comprehensive care, Omni Dental and Medspa is there to help.
You can find them right in Arlington Heights, Illinois at 305E Rand Road.
They also service a really wide area, including Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
You can reach them at 847-483-8833.
And their hours are Monday through Friday from 10 a.m. to 6 p.m.